Hi, my name is Dr. Roth IRA. I'm the owner of Performance Rehabilitation and Regeneration, and welcome to Episode 1 of The Dr. Y Show. Why am I making this show? I'll tell you why. I cannot tell you how many people, friends, colleagues, and other professionals that are having difficult time navigating our incredibly complex healthcare system. Who's the right specialist? What's the right technique? These questions are becoming overwhelming. There is so much marketing and misinformation. I hope to help dispel some myths and hope you understand how you can confidently achieve your goals. And then the question is, why listen to me? I got a unique skill set. I'm a physiatrist. People often don't know what a physiatrist is, but it's a combination of a neurologist and a non-operating orthopedic surgeon smushed together. I was kind of an unusual fellow that pursued neuromusculoskeletal medicine, and I did additional or fellowship level training in sports medicine, procedure-oriented pain management, and electrophysiologic medicine. These skills allow me to provide a perspective and understanding unlike most specialties. Again, my specialty is based in function and performance, not just anatomic correction. Having said that, Spiker, hit me with the first question.
Daryl asks, I just started seeing a new doctor about my reoccurring back pain. I want to know your opinion on good daily habits to reduce these aches and pains.
Great question. I got to tell you, there's some things you can't change in life. Don't blame mom and dad, but genetics are what they are, and some genetics will predispose you to having spinal problems. There are things that we can modify, our weight and our conditioning. I will tell you the most important thing is flexibility. Flexibility is more important than strength and power when it comes to back health. But it's very easy to meet a quality physician to learn how to get good balanced mechanics.
Amy asks, my company started offering an HSA plan. I was wondering what the difference is between that and the basic insurance plan.
Amy, I got to tell you, it's night and day. They do different things. Your basic insurance plan is just that. It'll cover basic things. There's a lot of things insurance is denying every day, and it's going to increase. An HSA is your account that you control. It's a health savings account. And so with pre-tax dollars, you're utilizing these monies for what you choose. Maybe your insurance won't cover body work or massage. Your HSA does. Maybe it doesn't cover optical options, glasses, contacts, whatever. This will. Maybe it doesn't cover stem cell therapy. This will. And it folds over to the next year. It's a slam dunk. It's better than the FSA, where you lose the money every year if you don't use it all.
What's one thing I could be doing every day that will keep me pain-free?
I'll tell you, the single best thing is I would tell you that, people underestimate how much stress contributes to their overall pain and magnify a 2-level pain to 7. So I'd say get a good plan to control your psycho-emotional stress in life and have a good lifestyle. Nutrition is important. And again, as I've shared with other people, flexibility. Maintaining good mechanics and flexibility is vital.
Luke asks, I got an x-ray on my broken ankle. I know I should have asked this question, but I didn't. What does it mean when my doctor says bone on bone?
When the doctor says bone on bone, it should literally mean that a bone is resting on a bone. You have advanced arthritic changes to where there is no cartilage in between, and you're literally bone on bone. That is a term, unfortunately, used quite a bit and kind of inaccurately. And so unless you looked at the x-ray and saw the bone on bone, I don't know what to say. Sometimes there's a little embellishment, and there's a high variability in radiological interpretation. You can take an MRI to 10 different radiologists, and you'll get different reads. And so bone on bone means advanced arthrosis. But if it's truly bone on bone, see it for yourself.
In the next segment of the show, we ask Dr. Yadava a word or topic, and he gives us his thoughts. The word for this episode is micronutrients.
Or we could talk about nutrition and say nutrition is an important thing, but what does that mean? Yep. And I go, there's so many people with gut problems, and it's ever expanding. You can't turn on the TV without seeing a commercial about gut problems. Yeah. Hearing about leaky guts, all of these problems. And so you could take all this, it's a diagnosis. So yeah, it is. Leaky gut syndrome. It is. Really? Yeah. So you can have these problems with digestion, and you can speculate, whether it's all the preservatives, whether it's the hormones and everything in the meals, we can argue. Bottom line is you can take all the supplements in the world, but if the vehicle for absorption is your gut, may not get there. That's where IV micronutrient therapy is superior. Goes right into your vein, and it can supplement you with whatever you need. You want to build your hair and your nails, put some biotin in there. If you want to, you have an iron deficiency problem, it's consistent. We can address these things. There's a number of things, neuropathy. There's a number of things we can do through IV micronutrient therapy that you can't get through a pill form. That's the value of it. It is an adjunct to good nutrition. It's an adjunct to a good therapeutic program and other things you can do to prevent dysfunction.
So you're telling me if I have a leaky gut, I got to come to you?
I'm telling you, I'd be a great friend to you, yes. Especially if you are still depleted and they're just throwing more and more supplements at you, even vitamin D. I can get things moving a lot faster through an IV. Maybe you went out too hard in Vegas and you got to work hard on Monday. Come in, I get you an IV. We'll leader you. You'll be fine. Get your B vitamins in there. You'll be fine.
All right, now you're ready for your closing statement.
Thank you for tuning in to the Dr. Y Show. If you have any questions or comments, please use the hashtag AskDrY or the other vehicles, including comment below.
Thank you for watching and listening to the Dr. Y Show. If you would like to get your question featured on the show, we use a podcasting app called Anchor, where you can submit your question via audio. Or what you can do is comment in the comment section of this post. We also accept direct messages. Last thing, please give us a review on your platform of choice. We value your opinion, and this allows us to reach more people. Thank you for listening, and we will catch you in the next episode.